But researchers now find that people who take a regular aspirin or other anti-inflammatory medications can reduce their risk of skin cancer. Dr. Zorba Paster here with more on that, and I kind of like the sound of this because I take a daily aspirin and have wrestled with skin cancer before. What does it do? What does the aspirin do?
Well, the mechanism, aspirin reduces something called COX-1 and COX-2, and these are certain chemicals called prostaglandins within the body. They reduce inflammation. That's why we take it, in higher doses for our joints sometimes, and it's the reduction of this inflammation that may be, in fact, reducing the risk of skin cancer.
If you're taking the aspirin, you should still do your sunscreen or sunblock.
Absolutely.
Don't give that
Absolutely. You still have to make sure you wear sunscreen, broad-brimmed hat to protect yourself. You know, if you're out in the sun all the time, you want to use protection. And the tanning beds definitely produce skin cancer, despite the fact that they say they don't. And the study was interesting. There were 200,000 people in Northern Europe and Denmark, and they found there was about a 25 to 30% reduction in melanoma, the bad skin cancer, and squamous cell carcinoma, another one. These are the skin cancers that kill you. Interesting data.
That has some credibility. That many people and for that long of a time. Would you get, as a doctor, would you say,
it has credibility because they followed it, but it's not, the double-blind placebo-controlled trial is the most credible. But I think this comes on the edge, if you will, of other studies that have shown there's a reduction in bladder cancer, a reduction in prostate cancer, a reduction in precancerous polyps for colon cancer, and in some people with a special cancer syndrome called Lynch syndrome, there's a reduction in colon cancer. So I think the real question is, why should you not take an aspirin a day?
I was going to say the aspirin is like a miracle drug.
Except it causes GI bleeds in some
that's
people.
Right.
And for some people, it can actually cause a certain type of stroke called a hemorrhagic stroke. So we still have risks involved, but on the whole, I think taking an aspirin a day is worthwhile. And this just shows another major miracle that aspirin does, and it's cheap.
Oh yeah, you don't have to. You can buy the generic, right, for this.
You can buy the generic. Better to buy a coated aspirin. It tastes better. Doesn't have any taste to it. I kind of don't like the taste of aspirin when it goes down, so I have a coated aspirin.
Before someone runs out and gets their bottle of aspirin, would you have them recommend talk to their doctor first because of the bleeding
we always give that disclaimer. Talk to your doctor first. I think you can make your own decision. Come on, take an aspirin. However, if you're on a drug such as Coumadin and you may bleed, talk to your doctor. If you've had a bleeding ulcer, you should not take an aspirin a day because you should talk to your doctor before you do it. Some people will be on it. And if you're wondering what you should do, always have a good relationship with your doctor. But I think this data shows aspirin again is useful. Make a decision.
Excellent. I like that. You can make the decision on your own.
Absolutely.
People. Very good. Doctor, thank you very much.
A pleasure.
All right. We'll be right back.